And I like the last conversation that we had, that you said how the nurses weren't really meeting your need, and you had to go to your doctor and allow him to take the time to listen to what you had to say in reference to what you were going through and experiences. So
I think that's why I'm saying it is very important for me for each one of us as a healthcare provider, whatever discipline, to be willing to listen to the other person, because sometimes I have also known myself to think I know what they are going through, but then I find that they are repeating themselves over and over and over, trying to explain something. And when I actually sit and stop what I am doing and take out my own agenda and listen to them, you end up hearing something very different. My experience when the last time I was in the hospital was saying I'm in pain and this is the kind of pain I'm going through, and I kept on, this is the pill the doctor has written for you, so that's what you need to be taking. Until the doctor came in 3 days after, and I told him that there is something a lot more than what you're treating. They took me through some exam only to find that there was a lot more problem that they were treating, and I think that's a good example of what a lot of patients may be projecting if only we listen to them a lot more.
mm-hmm.
Yeah.
Thank you for that. And then we're going to discuss the health-related beliefs. So, Dr. Penny, what are your cultural beliefs about illness and disease?
I grew up in a place where sometimes, like I said, we live in denial. I know I'm sick, but depending on what sometimes people are going through. A good example is the field you and I are working in, mental health,
Mm-hmm.
HIV and AIDS. There are areas of sicknesses where there is stigma, shame, and so people are not going to come out. And some people know what they are going through, but because they don't want to be condemned, they don't want to be judged, they will live in hiding. And the impact of that, take HIV and AIDS, they wait until they are full blown, and they only come out when they have no choice because it is visible. Mental health as well. There are people who wait until they are completely depressed, end up suicidal.
Mm-hmm.
And this may be something that could have been taken care of. So my wish is that we would be more accommodating, that we would stop judging anybody,
Yes.
because whatever disease this person is struggling with could be you or
Yes.
me or any of our families. So those are some of the taboos that I think need to be taken care of. Let's address these issues. AIDS is real, mental health is real, they are here.
Yes.
We need to be open-minded about it and reach out to people with an open heart, with an encouragement for them rather than a judgment.
Yeah, because a lot of them, when they come in, if they have a lot of tattoos,
Mm-hmm.
usually I ask them, is it some underlying reason? And then they always want to say, people judge them and how we see them, and I tell them I don't look down on the tattoos and things, because to me it's a form of art.
Mm-hmm.
And for some, on the other hand, it may be a mechanism for cutting
Yes.
and release.
Mm-hmm.
So when they have all those, I never look down on anyone.
Yeah.
So. And then are there any specific religious practices I need to be aware of related to healthcare needs or beliefs in your country?
Yeah, there are times when, in the past, when somebody was sick, people would judge them and say, maybe you are sick because of something you have done or something you didn't do. The taboos of getting this disease or maybe somebody cursed you, or witchcraft.
Mm-hmm.
And sometimes because of that history in our past, when you talk about maybe somebody put a curse on you, it may be that there is not a curse in them, but something is not working in them. But because of that inhibition, because of that belief, they feel they instead of going to the doctors, they go to the witch doctors.
Okay.
So, and even here, sometimes you hear that somebody has come to the doctor, but you are here busy trying to talk them and get them to see what is going on, but there is something they are not telling you.
Yes, yes. So how important is it to seek spiritual and cultural healers when someone is physically or mentally sick in your country?
There is a place of each of that. I think it is important to respect that before we had medicine and technology in our country, we were still dealing with our own issues. Sickness was there, poor health was there. So, and the community sustained itself either by herbal treatment, herbal medicine. We were taught to pray from a very early age. I found my parents praying, even though people think that there was no Christianity. There was Christianity. There was religion. There was the fear of God. There is dependence on God from time immemorial. And so I grew up knowing that there were times when I was sick and there was no medicine available. Maybe the herbs would be given, but I remember my mother telling us we need to pray about this. So there is need for spirituality. And even today there is a place for spirituality, because oftentimes when one is sick there is fear, there is uncertainty, there is anxiety. Some of these things here you can give somebody a pill, but there is a lot more going on than just where a pill can work. So a combination of spirituality, the assurance, the comfort, the encouragement that spirituality brings into us, a sense of hope, goes a long way to compound the effect and the impact of medicines. So the doctors, I do believe that there is a place for all the disciplines, whether it is a doctor, a nurse, a chaplain, a minister, there is a place for all that.
And getting to winding down to the close of our interview, religion and spirituality, how significant would you say your religion and health promotion related to a speedy recovery after surgery or illness is for you?
It is, because healing is a process. It cannot be, especially after a major illness, cancer, heart attack, surgery of any one kind or another. It cannot happen instantly. You cannot get out of surgery and get well tomorrow. So there will be a process. And many times a patient will be taking medication. You get well in, like when they say you have to wait 6-8 weeks before you can walk again. You can get back in the normal life. In the process, your heart is disturbed. You are anxious about what is going on in your family. You cannot provide for your family, and there is no pill for that anxiety. There are needs that are not met. And every now and again, I am needing, or a patient or a family will need to know that while all this is happening, there is a higher power actually protecting me, providing for me, encouraging me in what I'm going through. And I do believe that even our healing ministry, the doctors, the nurses, is it not true that you can only do so much?
Yes.
So there is a higher power that actually that equips you and me to do what we do.
Yes.
And I want to be, and that comforts me in knowing that it's not all about me.
Right.
There is a power, there is a God, there is a need, there is a spiritual being inside each one of us. It's not about which religion I belong to, because it's not a religion, but it is who do we believe in, who am I trusting, who equips you and me to do what we do. It is God for me. It is knowing that I am just a vessel, but I have a master who equips me to do what I do. There is a master who equips you to do what you do. When you're giving patients the medicine and nothing is working, or it is working and they are not patient enough, you and I will need to depend on something or somebody who can give me the patience when everybody else is falling apart around us.
Yes, because I'm looking at my mother now. She, we was talking about how well she was doing, and she'd been having her little episodes. And like I was telling my brother, when Mama get like that, she doesn't need to hear that so-and-so is dying, because she's projecting and she's hearing all this. And she needs to make sure she drinks and she eats, because when she doesn't do that and she lets her mind run because of her manic depressive, then she projecting that nobody sleeps around her. Wow. So that's what's been going on with her. And so just hearing her, she said, just hearing my voice, I seen her on Sunday, this past Sunday, but then she's cycling. She's going through a cycle because that's what they cycle with manic depressive, and he don't understand it, and they don't understand it. So I try and help him, and so he said she slept wonderful last night. So I said, don't wake her, just let her rest. But I understand that because it's not just a pill that is a cure-all; it's the other things that go along with it, the hand, the comfort, the caring that they feel and see. And that's what he said, that she said that nobody cared for her. So he's seeing what I go through basically on a day-to-day basis when I'm getting here. Only his is more personal, and it's different. Trust me, it's different.
Well, it's very different when you're dealing with your own, your mother, your child, your spouse. But I still want to say that for the calmness we need as we go through the storms of what we are hearing